It's probably averted already. Because first of all, yes, yung 18 that was even before yung GCQ bubble. So we had the GCQ bubble, we had the ECQ. So right now it's probably not gonna hit 18,000. Baka yung upper range natin yung mga maybe 13,000. Maybe it could hit a little more than that, pero we don't think it's gonna hit 18. It's possible na baka ma-extend ito ng government. Maybe not ECQ, maybe MECQ. Because ang mangyayari, kung bumalik lang tayo sa dati, tataas na naman yung numbers when we're not yet, we haven't recovered yet from the variants. Kasi kailangan talaga natin makontrol yung variants.
That was the Okta Research Group citing data that suggests the bubble has somehow slowed down the spread of the virus. They've downgraded earlier predictions. They now say cases should no longer hit 18,000 a day by mid-April.
But that does not mean a downward trend in cases. Well, at least for the health department, they are recommending that the enhanced community quarantine be extended beyond April 4. Good evening, I'm Gretchen Hall.
I'm Robbie Alampay. You're watching The Big Story. Let's begin with the enhanced community quarantine in Metro Manila and nearby provinces, effectively slowing down the spread of COVID-19.
Experts say we will likely see a downtrend in the coming weeks, but an ECQ extension may be due. Jess De Los Santos has the big story.
The bubble might have worked after all, at least according to the latest data by the Okta Research Group. On March 15, Okta projected a catastrophic surge in COVID-19 cases, 18,000 new daily infections by April 15. But that has been averted. Speaking to 1PHS sa Totoo Lang, the Okta Research Group attributed it to the NCR Plus bubble and the reimposition of the enhanced community quarantine this week.
Upper range natin yung mga maybe 13,000. Maybe it could hit a little more than that, pero we don't think it's going to hit 18, that range anymore. We probably will reach up to about 12 or 13,000 before we will go on a downward trend.
But in One News's The Chiefs, Health Undersecretary Maria Rosario Vergeres said, expect a continuous uptrend in cases.
In this 1 week that we will have for this ECQ, we won't see any changes in the numbers, or we won't see any changes in the utilization rates in our hospital. This is so short a time for us to do that assessment and have that effect.
The DOH has recommended extending for another week the ECQ in Metro Manila and the provinces of Bulacan, Cavite, Laguna, and Rizal. This is to further stem the COVID-19 spread and decongest hospitals and isolation facilities.
So nakikita po natin na nahihirapan yung sistema natin. We are choking. We are having full capacities in ERs, in ICUs. So gusto ho nating ma-manage ng maayos.
David echoed this sentiment.
It's possible na baka ma-extend ito ng government. Maybe not ECQ, maybe MECQ. Because ang mangyayari, kung bumalik lang tayo sa dati, tataas na naman yung numbers when we're not yet, we haven't recovered yet from the variants.
David warned there may be an artificial dip in the daily tally of new infections, especially as many testing centers are closed during the Holy Week. He reminded the public to not be complacent.
The national government may have more confidence na sabihin, oh, well, it worked. Bumaba yung cases.
And people too.
And people too. And then we relax the restrictions. Mag-open up, ibalik na natin sa GCQ, kahit GCQ bubble, pero artificial lang pa yun.
Jess De Los Santos, we are One News.
Is a 1 week lockdown actually enough to bring down the recent surge in cases? To give us their take on the matter, we have with us National Task Force Against COVID-19 spokesman Restituto Padilla. Mr. Padilla, welcome to The Big Story.
Good evening, Robbie, and thank you for having us.
Sir, I mean, Okta is having some room for some hope. They're now saying the worst forecast they had should no longer come to pass. They're revising downwards their projections for the middle of April. what is the most that they hope to achieve in this 1 week lockdown?
Well, we have to look at the science behind the virus. And once a person is infected, it doesn't manifest until about a few days, and the illness remains for about 2 weeks. So, judging from the way the virus works, the trend in lowering down of cases might not reflect immediately the week after, but it might reflect on the week following, or the week following that other week. So by and large, if you want to see how much effect this current ECQ is having, especially in the areas declared under ECQ, which is Greater Manila, we will have to look forward to 2 weeks to 3 weeks. So we will have to watch closely all the data that is coming from this area to find out if we need to ease up or keep it up to see more lowering of cases.
Okay, speaking of which, we want to see whether we need to ease up or be a little bit stricter in certain areas. Ano po ba ang nakikita natin for the rest of Holy Week? Is there anything else that has to be added to the guidelines, or at least that people should be aware of?
Well, Robbie, nung nakaraang taon naman, nung nag-implement tayo ng ECQ, madami na tayo natutuhan. So part of that is really to strengthen the strategy against COVID. And the strategy actually calls for doing the PDITR strategy, which is preventing, detecting, isolating, treating, and integrating. So for the preventive side, we're actually doing it. We keep on reminding people to do their part, but the detection and the isolation and the treatment is the critical parts now. So we have to detect, we have to do more to contact tracing, and that's what DOH and what the LGUs are doing, what other sectors are pitching in. So the detecting portion is actually the testing portion, and we're ramping up our testing. So pati ngayon, today, sinabi na ng DOH that we will use the antigen results from those testings as additions to the cases that might be counted. So if we keep on doing this, we will find the unseen enemy that's lurking around, because yun ang pinaka nakakatakot, yung mga asymptomatic, akala nila okay sila, pero nagkakalat na rin sila, lalo na kung hindi sila nagsusuot ng maayos ng mask sa face shield at nag-observe ng minimum public health standards. So once we find out where these cases are, especially in the high incidence cases or high incidence areas, we will be able to isolate them and treat them as necessary.
Okay, sir, if we start counting yung mga antigen, does that mean that people should be braced for higher numbers?
Well, perhaps yes. If the surveillance that we will be doing, what we will see, there will be a slight uptick of cases, or be able to find out where other people sick with COVID are still around. So this might not have reflected, or hindi sila nag-indicate dun sa mga previous tests. So baka ngayon mas makita natin, kaya yung bilang maaaring tataas yan. At ang maganda dyan, alam na natin kung nasaan. At alam na natin yung dapat natin gawin, which is to isolate them at maiwasan yung pagkalat at pagkahawa ng iba.
Maraming salamat po, Mr. Padilla. That was NTF COVID-19 spokesman Restituto Padilla. The Budget Department has released the order for the planned aid to NCR Plus residents during ECQ. Thrice big number, 22.9 billion pesos. That is the budget allotted to cover aid for close to 23 million residents under ECQ areas. The Budget Department says it's up to LGUs whether the assistance will be in cash or in kind. Each person may receive 1,000 pesos, but not more than 4,000 pesos per family. As for the rest of the country, MECQ is in effect the whole month of April in Santiago City, Isabela, and until the 15th in Quirino. Under GCQ, the CAR, Cagayan, Isabela, Nueva Vizcaya, and Batangas in Luzon, Tacloban City in Visayas, and Iligan City, Davao City, and Lanao del Sur in Mindanao. The rest of the country will be under MGCQ.
These are the other big stories tonight. The president may have said last night that the private sector should be able to procure vaccines at will, but his officials clarify a direct purchase is still not possible. Not taking chances, the FDA has deployed inspectors in Metro Manila to counter a possible spread of fake COVID-19 vaccines. The World Health Organization has flagged the spread of other counterfeit jabs in other countries. And with utilization rates of hospitals already reaching critical level, especially in Metro Manila, Some COVID-19 patients are either forced to wait or attended to outside of health facilities. These big stories right after the break.
You're still watching The Big Story. I'm Robbie Alampay. Health authorities are keeping an eye out for fake vaccines that are reportedly in circulation across several countries. The local FDA has deployed inspectors in Metro Manila as a proactive measure. Greg Gregorio with the details.
The World Health Organization flags the proliferation of counterfeit Pfizer and BioNTech COVID-19 vaccines. In its March 26 medical product alert, the WHO said a number of fake jabs found their way to patients in Mexico as early as February. American pharmaceutical firm Pfizer has already clarified with the WHO that the counterfeit products were not from them. They also insisted that the lot number and expiry dates were falsified.
Recently lang, na-confirm na ng WHO that this is falsified. So ito po ay tinignan nila, ininspekta, nakita po nila based on the batch number, based on the vials, based on the labels, nakita nila that this is false.
The Food and Drug Administration has also been notified by the Interpol of the same incident in another country.
What was reported by the Interpol is in South Africa, they were able to seize around 400 ampules without any label po in one warehouse.
According to FDA, they have also received a number of reports about alleged fake COVID-19 vaccines in the country. Although they did not mention how many, they say they have not yet seized any fake jabs.
As of now po, there are no fake vaccines in the Philippines yet. That's why we are trying to prevent their entry into our supply chain.
With this, the agency is beefing up its measures against counterfeit vaccines. The FDA currently has 52 inspectors across Metro Manila. A counterfeit product may be identified based on the appearance of the vials, packaging, and correct labeling. The Health Department is reminding the public to only receive jabs that went through the national government.
Para po kayo ay sigurado that this is legitimate, this has been this has undergone the stringent regulatory process, and we can assure you that these vaccines are safe and it's going to provide you the protection that you need.
Under the Food and Drug Administration Act of 2009, those proven to be manufacturing and distributing counterfeit products may face 1 year to 10 years of imprisonment or face fines from 50,000 pesos to as much as 5 million pesos. For News 5, Greg Gregorio, we are One News.
In a televised briefing, President Duterte said he will allow the private sector to import COVID-19 vaccines at will. But Vaccine Czar Carlito Galvez says direct vaccine procurement for the private sector is still not allowed. Galvez clarified firms must still enter a tripartite agreement with the government and the manufacturing company for the purchase of vaccines. He said the president only wanted to speed up the process for such deals to avoid delays in vaccine procurement. And with vaccines only given emergency use authorization, the palace said shots cannot be sold commercially.
Pareho lang po, pero gaya sabi nga ni Secretary Galvez, pinabibilis lang yung proseso. Kung ngayon po, hindi na kinakailangan sumama sa federasyon, hindi na kinakailangan sumama sa organisasyon. Kung isang kumpanya gustong bumili para sa empleyado, pipirmahan na po natin ang kanilang tripartite agreement.
These are the other big stories tonight. The Health Department logged more than 9,000 new cases today, bringing the country's total caseload to more than 740,000. Of these, almost 125,000 are active or are currently sick, the highest since the pandemic began. The government will be scaling up its vaccination rollout with a bold weekly target of 500,000 to 1 million in April and May. By middle of the year, the government hopes to inoculate 2 to 3 million Filipinos per week. And by December, 3 to 5 million. Vaccine czar Carlito Galvez said this will help the country achieve herd immunity and have a better Christmas this year. Galvez also said Filipinos identified in the government's vaccination priority list will be getting COVID-19 jabs whether or not they have a PhilHealth number. Galvez added those eligible for the doses will only have to show any valid ID. The clarification comes after PhilHealth President and CEO Dante Gueran said that PhilHealth identification numbers will be required in the inoculation drive. The COVID situation in Santa Ana Hospital may already be getting out of hand. Beds are all occupied, while more nurses have stopped reporting for work. Jacob Lazaro gives us a front seat to the big story.
Nowhere is the surge felt more desperately than in the Santa Ana Hospital in Manila. Here, the COVID beds are not just fully occupied, they're already spilling over.
Okay, for Santa Ana Hospital, it's really in the critical level. Now we're over 100%. Not counting the patients at the tent. There are suspects still waiting for results.
From the original 90 assigned COVID beds, Santa Ana Hospital had to add 28 more. This means that its COVID capacity is now at 138%. Some patients are already staying in wheelchairs while waiting for vacancies. 2 isolation tents that catered to 8 people before now have 19 patients crammed inside without social distancing. Incoming patients have to wait several days or transfer to another hospital. Some have been here for a week.
These are patients waiting. They have a room upstairs, but we have no vacancy upstairs. They've been here for 2 to 3 days. Some of them 1 week already.
With the hot weather, patients here have a hard time breathing. Families tirelessly fan their loved ones. With the dwindling supplies, they're asking for more mechanical ventilators, stretchers, and medicine.
We don't have stretchers. We just have floating beds. Please give us stretchers.
Santa Ana is just a sampling of what the capital city is now going through. Manila has the second highest number of COVID cases in Metro Manila, the epicenter of the pandemic. While the health department says that 98% of patients nationwide are asymptomatic or mild, on the ground here, the numbers are different. 6 out of 10 patients here are moderate, severe to critical.
Our ICU is full. Our mechanical ventilators are used also. So lahat yun gamit ng patients. So just you can just imagine a lot of patients now are in need of critical care.
Healthcare workers are also feeling the grind, with 30 healthcare workers already testing positive for COVID. Some doctors and nurses end up working for up to 24 hours straight. Absenteeism among nurses due to exhaustion has already started to become a problem. Dr. Dominguez says it cannot be denied that healthcare workers are exhausted, but counts on each other for support.
We will do as much as we can, but I hope the patients will understand. But we will not show away patients. But we can help, but this is what we can give for you for now.
Yes, I am. But the surge is far from over, with numbers now hovering above 10,000 new cases per day. To decongest our hospitals, the Department of Health says they will strongly implement transferring mild and asymptomatic cases to quarantine facilities. Our healthcare workers pay the price when necessary action come in too late. It's time to be more proactive and lay down a clear strategy that can literally save thousands of lives. I'm Jacob Lazaro and we are One News.
Let's pause for another quick break. More big stories when we return. Keep it here on One News.
You're still watching The Big Story. I'm Robbie Alampay. This year's Holy Week falls on yet another strict quarantine, but devotees are still carrying on with tradition, at least online. Camille Samonte with this story.
This uninterrupted chanting could only mean one thing, the start of the Lenten week in the Philippines. And for the devout, there's no stopping them from singing hymns, even the pandemic. This has been a yearly tradition for the Fermin family of Caloocan since 1995. But this is the first time they're doing it wearing masks, socially distanced, and online. Yes, they're streaming the pabasa as they have limited attendance to immediate family members.
Napipilitan ngayon kaming magmaskara. Kahit na sa totoo, mahirap yung kumakanta ka matagal na nakamaskara, mahirap yung paghinga, pero kailangan tayo kasing mag-ingat. Kahit na sama-sama kami sa loob ng bahay, kailangan ding mag-ingat.
What used to be an all-day event had to be reduced to 3 hours as well.
Pero pinagpapatuloy ko pa rin at ito ay parang pagpipinitensya rin at natututuhan natin, nalalaman natin ang buong buhay na dinanas ng ating Panginoong Jesucristo.
Religious gatherings have been put to a halt during the implementation of the enhanced community quarantine in the NCR Plus bubble, forcing churches to resort to online means to observe Holy Week.
Maglilihi ang isang dalaga at magsisilang ng sanggol na lalaki.
This is the case for St. John Bosco Parish in Tondo. They are going online for this year's staging of the Cenaculo, a stage play about the life and passion of Christ. Every scene was shot using a smartphone, green screen, and special effects. This may be a deviation from their tradition, but the group is willing to take advantage of the digital platform.
Nilagyan namin ng CGI effects and VFX para mas eye-catchy at must-watch para sa mga manonood.
Parish priest Father Gaudencio Carandang is hoping that despite the crisis, the Cenaculo will remind more people of the love and sacrifices of Jesus Christ.
Itong sinakulong ito ay ginawa namin hindi para bumilib kayo, kundi para bumait tayong lahat. So mabuhay tayo at patuloy tayong lumaban na sama-sama sa pandemyang ito.
The film Cenaculo will be released on the Facebook page of Cenaculo 2021 in St. John Bosco Parish, Tondo from April 1 until 3. For News 5, Camille Samonte, We Are One News.
OPM icon Claire de la Fuente has died of cardiac arrest.
The stranded cargo ship in the Suez Canal has finally been freed. Tugs refloated the giant Ever Given ship late Monday, allowing traffic to resume in the busy waterway. The Suez Canal Authority said a backlog of more than 420 ships could be cleared in around 3 days. Dutch firm Smith Salvage said some 30,000 cubic meters of sand had been dredged to refloat the massive container ship. A total of 11 tugs and 2 powerful sea tugs were used to pull the ship free. And that wraps up today's big story. Catch us again tomorrow on Signal Channels 8 and 250. Please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph. Mask on, wash hands, and stay safe, Philippines. Oh, welcome back, French.
Let's all stay negative and be positive. If that big ship can make it out of the Suez Canal, we can also make it out of this pandemic.
That's right. And we can figure out the technical glitches. I mean, we're all working from home. But hindi na rin natin nabasa. We did have an item about more people, of course, getting infected with COVID-19. Kasama po dyan mga kapatid natin. Ted Filon and also Cheryl Cosim testing positive. Of course, but asymptomatic naman po sila. But we're just saying this for transparency's sake, but also to remind everybody, as we said, stay safe. Totoo po to. It's better to stay home, stay safe, monitor yourselves, take care of each other.
And stay negative. My name is Gretchen Ho, and you are?
I'm Robbie Alampay, and we are One News.
Have a good